In Jesus' name we pray. Amen.
Amen. Thank you, Pastor Fulton.
You're welcome.
We have no awards or proclamations or presentations. We'll move on to the approval of the agenda. And I need to make some corrections on, let's see, it's under item 7, there was a resolution number 2343. And on the second page, the estimated cost of the project needs to be changed to $5,580,000. And in that, under that same number 7, there is a petition for creation of a community improvement district, and they had not signed it, and you now have a signed copy signed by Jasmine Ball. So those two items need to be corrected on the agenda.
I'll make the motion that we approve the agenda as amended.
Second.
Motion by Commissioner Martinez, second by Commissioner Harden, to approve the agenda as amended. Any discussion?
I would have some discussion here. On the petition for creation of a community improvement district, Cindy, is that the amount that the mayor stated, is that the accurate amount, the 5 million something?
The what? 1,500,000.
The amount
It
of-
should be 1,000,000.
Okay, you said
Oh,
5
yeah,
million.
that's
Five.
right.
I just wanted to-
Sorry.
That's okay.
I'm sorry.
No, that's fine. I just want to
You
clarify
wanted to
that.
do a real good parking lot, huh?
Okay, so that's all.
I
Thank
need
you.
to move my thing down. I can't see.
I just want to make sure that was
Thank you.
clarified for everyone.
Thank you.
Yep, that's all.
Let's see. Did we approve that?
No, I interrupted you
Okay.
here calling about discussion.
Any discussion? All in favor? Motion carries 5-0. The next item is the minutes. Approve the November 10th, 2020 regular meeting minutes.
Make a motion that we approve the November 10th, 2020 regular meeting minutes.
Second.
Motion by Commissioner Harden, second by Commissioner Lindenbroker, to approve the November 10th, 2020 regular meeting minutes. Any discussion? All in favor? Motion carries 5-0. The next item is the consent agenda.
Make a motion that we approve the consent agenda as printed.
Second.
Motion by Commissioner Harden, second by Commissioner Warren, to approve the consent agenda as printed. Any discussion? All in favor? Motion carries 5-0. The next is ordinance number 4545.
Sure. Commissioners, every year they put out a new standard traffic ordinance book, and a uniform public offense code is what we use for enforcement of violations in city court. But this year, for the standard traffic ordinance, they actually just reprinted it, but they put out a new version, so I just decided we adopt that as well. There's no changes really of any substance in either of those that I think warrant any discussion. So we're requesting that the commission go ahead and approve that ordinance so we can use those books for enforcement in city court and for law enforcement.
We have a motion to approve ordinance 45.
I'll make the motion we approve ordinance number 4545.
Second.
Motion by Commissioner Martinez, second by Commissioner Harden, to approve ordinance 4545. Any discussion? All in favor? Motion carries 5-0. The next item is ordinance 4546.
It's the Uniform Public Offense Code. The first one was the standard traffic ordinance. If you see in that ordinance, there is one section of the Uniform Public Offense Code which the commission previously adopted out of regarding discharge of air gun, air rifle, bows, and arrows. So there's that language in there which just restates the commission to modify that section and adopt it.
I'll make a motion that we approve ordinance number 4546.
Second.
Motion by
Hi, Sarah.
Commissioner Harden, second by Commissioner Warren, that we approve
That's
ordinance
okay. I'm gonna put you
4546.
voting on the next one,
Any
and then you're
discussion?
up.
All
Hold
in
on just for a
favor?
moment.
Motion carries 5-0. Now we're on to
Okay, I'm gonna put you on
item
speaker.
number 7, which is resolution number 2343.
And Commissioners, Mayor, we do have Sarah still on the phone. She's on speaker right now in case there's any questions.
Okay, welcome, Sarah. Thank you.
I don't got any questions, but I think that's gonna be great to fix that parking lot.
Good evening. Thanks for letting me call in.
Absolutely, thanks for joining us.
Do you guys have any questions for us still? Okay. Sarah, they do not have any questions at this time. Okay, thank you. Bye.
This is a resolution calling and providing for the giving of notice of a public hearing on the advisability of creating a community improvement district in the city of Liberal, Kansas, for the proposed levy of a community improvement district sales tax within such district for Southgate Mall CID. Can I have a motion to approve this resolution?
I'll make a motion, we approve resolution number 2343.
Second.
Motion by Commissioner Martinez, second by Commissioner Harden to approve resolution number 2343. Any discussion? All in favor? Motion carries. 5-0. And it's my understanding we don't have to do anything about the petition. It's included in that. We just keep going.
Correct.
Okay. The next item is number 8, contract for sale of land.
Yeah, if you send it to me, I have no way of getting it.
I sent this quite a while back to the city clerk. I'll get to it on my agenda here. And Cindy, I think this was something you have helped deal with as well, correct?
Do you want to explain?
Sure, if you could explain to the commission, I'd appreciate it.
The podium.
Where's the podium?
Just on the other side.
The other side. North of here.
Oh, over here.
I didn't see it, I'm sorry.
Just stand on it.
Right here.
Yeah.
Okay, sorry. I was looking for a regular podium. Kroll, C-R-O-E-L-L, you've seen some of their trucks now in town. It's a company out of Iowa. They purchased we had the ready mix already here that they purchased out at the industrial park, and they want to move it, and I helped show them available sites and land. He chose out at the East Industrial Park there on Wildcat Lane, I think, Wildcat Boulevard. It's a piece of land, it's a little over 9 acres. They made the offer on it. We got value, basically appraised value on surrounding land and what some of the other businesses bought it for. So we're just now getting it finally finalized so he can start building his ready mix business. It'll have 3 bays in it. He said it'll look really, really nice. So that's pretty much it. So we got that one piece of land out there sold.
So, and this contract, the buyer's attorney and myself went over this contract and got negotiated. So I approve this contract as printed if the commission wants to go forward with you, allowing them to purchase this ground to basically build a business here in Liberal, Kansas.
Okay, we need to approve all of Block 13, of Block 1 of the East Liberal Industrial Park addition to the city of Liberal, Seward County, Kansas, for the amount of $71,600 to Krill Inc., closing date December 1st, 2020.
So moved.
Okay, thank you.
Second.
Motion by Commissioner Warren, second by Commissioner Harden to approve the sale of the land to Krill. Any discussion? All in favor? Motion carries. 5-0.
Thank you very much, Cindy.
You're welcome. Number 9 is the Christmas parade, Earl Walk.
Good evening, Your Honor.
I knew I had seen you.
Hey, how we doing? Well, I just wanted to explain to the commission tonight the plan for the parade. Obviously, this is a different year, and so we've had to plan accordingly to make sure that it would be safe for everyone involved. One of the things that we're going to be doing differently. The biggest issue that we would have with any kind of gathering is typically right at the end of the parade where everyone wants to gather by the stage area. Two reasons cause that. One is when we judge the floats, it's taking place at that time after the parade. We're not going to do that. We're going to have the floats judged while they're being set up. The judges will judge beforehand. So when the parade's coming down, we will be able to announce who the winners are as the parade is going. So there'll be no delay after the parade is over. The second thing is picking the winners of the contest. And once you pick those three names, everyone else scatters. So by eliminating those delays at the end of the parade, we will have eliminated the gathering up by the stage. There will be no gathering, and we will be announcing not to gather, that you must stay where you're at in your family group and 6 feet away from the next family group and so on, so that social distancing is being practiced. So we will be promoting that. For any entertainment prior to the parade, the crowd size is minimal, and we will be sanitizing the microphone between performances, and anyone who comes up on stage will have to wear a mask. And I think I saw Greg come in here. Greg. And so I talked with the county commissioners today, and they said get with Greg that they might be able to get us some masks available so that anyone who would come up to the stage, anyone who's helping, like our sound people, will be quarantined off from crowd approaching them. So they will be 6 feet away from anybody as well. So one person on the stage at a time, and when the winners come up, they will have to be masked. They will pick their 3 envelopes. Everyone else scatters. I mean, I wish that the crowd stayed to see what everyone wins. They don't. If they don't win, they leave. So as soon as the parade is over, we'll draw 3 names, and the crowd's going to disperse. The big delay is usually waiting for the float winners while the judges deliberate, and that won't take place. And that eliminates the biggest delay. But I'm here to answer any questions or any suggestions, recommendations anybody would have.
What time will this start, Earl?
The parade starts at 6 and is typically over at 7.
Is the parade route the same distance as it was before?
And we've shortened it to 6th Street to the tracks. So it starts, that way we don't hold up 7th Street for you guys on the city. That's a busy intersection. And we don't go to the Light Park anymore. We've shortened it down to just basically a 6-block parade.
I mean, it seems like you got the rest of the bases pretty well covered. Glad that we're still able to have it.
We hope so, and we appreciate it, and we do take it. We do take the responsibility seriously of making sure that we will be announcing to follow the safety protocols and do all that. And we hope to work with, like I say, Greg to have masks available. If not, we'll buy them. But if we can have masks available at the stage area for anyone who would need one, and you can't come up on stage unless you have one. That's just not going to happen up there. So. We appreciate it, and we will keep all that in mind. I just want to say good news here tonight. CID down south, that's outstanding news, and I love your clock on the wall. That looks great over there. So.
Will there be any vendors?
We are only planning, if any, would be possibly change up just to have some warm beverages at night. But if that's going to be a problem, then we won't have any vendors.
Yeah, I think everything else looks good to go with it.
All right.
Yes, sir.
Thank you, guys.
Thank you.
Thanks.
Next item is number 10, the police department purchase of a 2019 Ford Fusion.
Good evening, Chief Betchoff.
Well, good evening, sir.
Just covering all the bases.
Right. So on, on November 8th, 2020, the police department's 2010 Ford Fusion was totaled after it was struck by a deer. I mean, literally, it was struck by the deer. The vehicle needs to be replaced as soon as possible. After checking with Lewis, Chrysler Corner, and Foss Ford, We located a 2019 Ford Fusion that was definitely an acceptable replacement. The car needs to be, if the car is purchased, the car will be given to a patrol lieutenant who presently has a patrol vehicle that is marked. We need that vehicle back on the street for all the people that we have hired. We need marked police cars, so it'll be used in that direction. That way, we've got the marked patrol car back in the fleet. The insurance check has not arrived. I'm not even sure if we've even got a total on that at this point, but that would be placed back in the budget. The purchase from the would be taken from the police department equipment reserve fund.
Actually, if I remember correctly, the insurance settlement was going to be about $6,400. So roughly the cost of the car is about $10,100, $10,200. And there was a quote from Chrysler Corner. I don't know what happened, but it was $19,900. It was about $4,000 higher, $3,500 higher.
So the Ford Fusion is listed at 16.5. 16.5.
Make a motion that we purchase a 2019 Ford Fusion for $16,500 from Foss Ford here in town to come out of the PD Equipment Reserve Fund.
Second.
Motion by Commissioner Harden, second by Commissioner Martinez, that we purchase a 2019 Ford Fusion from Foss Motor Ford for $16,500, with the funds coming out of the police department equipment reserve fund. Any discussion? All in favor? Carried 5-0. Thank you.
Thank you.
Thank you very much, Chief.
Number 11 is the CARES Act.
Good evening, Karen.
Good evening, Mayor and Commissioners. This evening, presenting the funding that we're receiving from Seward County for CARES Act funding. We applied for environmental air treatment system for City Hall, portable broadcasting equipment. That'll be for any emergency that we need to be a remote location. So if maybe a different city building or outside, wherever that may be needed. Action training system for the fire department. That'll allow them to do training. Even if they were in quarantine, they could do training modules at their home. They can do it at the fire station or anywhere. The Surface Pro laptops for remote work. The payroll HR system, and Bruce will have more on that in a little bit. Keyless entry system for City Hall, which will be the card system similar, or not City Hall, but the other city buildings. It'll be similar to what we have here. And request acceptance of the memorandum and to execute and make purchases.
Do we need to do each individual purchase, or can we make one for the total amount of the, I think it's $143,770?
All of these items are on the memorandum of agreement, but that's up to Lynn. If
No, you can do it all in the one. The only inquiry I'd have, Karen, is the date that we're dealing with is December the 30th, that these items all need to be purchased and operational. If we can't make them operational by that date, then it may not qualify, and then we may have to pay that money out of our own pocket, so.
all of these have been verified as being able to receive before that time.
Receiving to be operational.
Yes.
Okay. I caution, if we get into a bind where it's not going to be, it could become problematic for the city on where we're gonna have to come up with funds for paying for these items, so.
Exactly.
County ran into that last night with the fire building.
Yeah.
So we can just make one motion for the total. Verification. The total amount on this is $143,773.50. And we can make a motion to accept the memorandum of agreement. So Perry County, give authorization to execute memorandum of agreement document to make the purchase of, CARES Act awards in the amount of $140,750 requested in the grant application.
I'll make a go ahead, Tony.
I'll make the motion, we accept the memorandum of agreement documents for the CARES Act grant award in the amount of $143,773.50.
Yes, that's right.
Second.
Motion by Commissioner Martinez, second by Commissioner Harden, that we accept the CARES grant award memorandum of agreement in the amount of $143,733.50. Any discussion? All in favor? Carried.
Thank you.
Thank you very much, Ken.
Item 12 is the new.
Did that include them all, or not separate?
There's a separate, I mean, they accepted the money, but you need to talk to them about the agreement that you have for that you and I discussed earlier for the time clock plus.
There's an agreement that company, right?
Correct.
Okay, what we have is a combination of CARES money of roughly 40,000 and a budgeted amount for this year of roughly 15,000, and we've been budgeting this for the last 3 or 4 years, trying to get this system up and running. So a combined budget, we're going to be right in with the CARES money and the budget money. We're going to be right on track. But we did talk about the timing. It's going to be challenging. The faster we can get an approval and get these guys rolling, they assured me we'll be able to purchase, receive, and operationalize the program. We would not be finished by December 31st. Technology is technology, and a new system is a new system. Basically, all we're doing is we're getting the punches from a clock, a different clock, sending it digitally to payroll instead of manually. We're not changing payroll, we're not changing the checks, we're not changing overtime calculation, holiday pay, nothing. We're just trying to get the time punches to the payroll system that we currently have, which is Central Square. We went with the same company that runs our financials right now. And there's a lot more to it, but I don't know how much you want to talk about it.
And I'll let everybody know I've reviewed the contract and spoke with Bruce before the meeting tonight. There's some things that I need to have changed within the contract, and some things that need to be attached that are referenced in the contract. My proposal, because we are in a time crunch, is to have the commission approve it subject to my approval with the company, and if we can't get it done, then it doesn't happen, unfortunately. Hopefully we can. Bruce says they're going to be easy to work with. I assume they would be, because they want to sell us their product and get money from the city for this to work. But there are just some things that I didn't have to review, and some items within the contract that I think need to be worded and changed. If you're comfortable doing that, we can vote that way. We could also potentially have a special meeting on Monday for 10 minutes if we can get it put together on Tuesday. I'd leave it up to the commission on how you guys want to proceed on it.
I have a question on the dollar figure.
Yes, ma'am.
Now, you have the two items listed, and they come to $55,270.83. Would you call that the budget cost? Do you have the budget and the total cost reversed?
No, no.
So how much money do you want?
The 5561.
Is the budget the total cost?
Yes, ma'am.
Well, there's a $344 difference between your item costs on these two items.
Calculator one.
Yeah, I see that right now.
It looks like you've got the titles reversed. The total cost should be the budget cost, and the combined budget should be the total cost, right?
I would have to relook at it real quick, but I think you're right.
Well, if you had the top two, the 39,815 and the 15,8, that gets you at your 55,615, right?
Yep.
So that's saying budgeted money, so that should be
Yep.
reversed then, so.
Yes, sir. Yes.
55,270.83 is what you need out of the 55,615 you have to work with.
Yeah, and we're buying the two products, which is the software and then the clocks are separately.
I'll make a motion that we approve the contract in the amount of $55,270.83, contingent that the city attorney's requested amendments are met.
Second.
Motion by,
Which mask I
Second is
seconded?
wrong.
okay. Motion by Commissioner Harden, second by Commissioner Warren, that we approve the, state your motion.
That we approve the contract contingent that the city attorney's requested amendments are met.
Any discussion? All in favor? Motion carried. 5-0.
Thank you, Bruce.
You have four and one against.
One opposed. Commissioner Lindenbroker is opposed. Sorry. Does the city staff have anything they want to say?
Going once? No.
Okay, the next is items from citizens. If you would like to talk to us, please limit your conversation to 5 minutes and come up to the podium, such as it is, and give us your name and your address, please.
Good evening.
Hello.
Hi, sorry I was late.
No problem.
I'm Elise Bigler. I'm a PA at Southwest Medical Center, and I'm in the hospitalist department there. My address is 1200 North New York Avenue here in Liberal, and I really get anxious and nervous talking in front of people, so bear with me, okay? I come here tonight, and I'm gonna try not to be emotional. What our hospital is going through and what our nurses are going through is, I mean, obviously we're in the middle of a pandemic, but on top of that, having a community that doesn't necessarily understand what we're going through is really, really tough. I really hope that you guys vote for the mask, a few things. Mask mandate is very important in protecting our citizens and keeping our businesses open. Science, all the science out there shows that it is proven that whenever two people both have masks on, the risk of transmission is so much lower. We've got to do something different. I mean, I just ran in here, I was late because we have 3 more admits with COVID. And I put in the orders real quick, ran here, and I'm gonna go back and admit 2 more people. I'm not saying anything like radical. It's just, if we had masks, or if we have masks whenever you're going into buildings, or if we're somewhere where socially distancing isn't possible, as in being, even greater than 6 feet apart isn't possible, people should be in masks. I spoke with Dr. Ilyasov before coming here. He wasn't able to make it, but he's the head of our hospitalist program, and most doctors across the nation who are handling COVID are in agreement that if we're inside, people need to be at least 6 feet apart, at least. So say I walk into Old Chicago, or I walk into Applebee's, I walk into one of these places, it should be required that tables are 6 feet apart. We're not saying shut it down. Wearing masks whenever you get up from the table, going to the bathroom, wearing a mask. It would really help us, I try not to watch the news because it's pretty biased, but this is a non-political statement. This is coming from health officials. It's coming from scientific data. It's not political. It's not political. We want things to be able to stay open. We want our hospital to be able to manage these things. I mean, we had a hospital call us and get a patient accepted to our hospital. You could hear the nurses in the background yelling. They were cheering because we were able to accept them to our hospital. They weren't COVID, but we were able to accept them. But all of the hospitals around are so full of COVID right now that, I mean, we have to do something to slow it down. And that thing is wearing masks and socially distancing. So I came here tonight just because I do feel like we're kind of shut away in the hospital, and a lot of times the public doesn't get to hear us, hear what we're feeling, hear what we're seeing, hear what the science is showing. We have to do something different. We have to. It's like a dagger in my heart whenever, I think it was last week, whenever the vote went up and there were some commissioners who decided not to say yes to a mask mandate. I mean, I was in tears. I go into the hospital today. We have a 41-year-old, a 45-year-old that are intubated, ventilated with, very young children. And I'm like, this is completely preventable. We could have socially distanced and mask mandate. So yeah, I'm gonna leave it there. I mean, if anyone has questions, please, ask us, ask the care providers, ask the doctors, ask PAs, we ask nurses. I mean, we are all on the same page. So yeah, I think that's all that I have to say for now, but thank you.
Thank you so much, Elise.
Good evening. My name is Elizabeth Irby. My address is 2120 Tulip Lane here in Liberal. And I probably should have jumped up before Elise spoke, just to let you know that we understand that this is not on your agenda this evening. We also understand that the Seward County Commissioners have decided to not follow the mandate that has been put out by our governor for the state of Kansas. And we are coming to you pleading for you to make a decision that we need you to make as healthcare workers, as citizens of the city of Liberal, to help protect the residents of our community, the people that come to our community to shop, that 1-cent sales tax that we're so proud of and we're glad that it's continuing, to help protect those people that come and shop here, that come and work here, that come for health care. We really need the city commissioners to step up and make this hard decision. We need you to be the leaders in our community. And I know that a question that the county commissioners had was to how to enforce this, but I would have to say this, from what I'm witnessing at the hospital, what my husband witnesses with USD 480 Liberal High School every day, is that if our leaders lead, the adults will follow, and then in turn the children will follow. My husband can say proudly he works for USD 480 and he's on his 12th year. Most all of you know him. And he helps pass out masks to the students that show up without masks on a daily basis. I myself am over all of the screeners at the hospital. Just within the last 24 hours, our screeners had to give out 41 masks in 24 hours. Now, I understand the county commissioners voiced that they see very few people out and about at Walmart and Dillon's without masks, but I can say that is not the case in a healthcare facility. And we truly need you to stand up and to be those elected officials that we have elected you to do, to make those hard decisions. I beg you to do this. It gives the enforcement, I do not expect you to enforce it, but you can lead by example and we can follow. It will give those screeners at the locations of businesses, at the hospital, different places in the community, at least something to say when someone walks in and says, no, I don't have to wear a mask because the Seward County Commissioner said I didn't have to, and I can sue you if you make me. Those are words that I witnessed from one of our county commissioners saying to the screeners at Southwest Medical Center. So if you implement a mask mandate, that is leading by example, and those screeners can then say, the Seward County Commissioners said no, but our city commissioners are supporting us. They want you to be safe, and here's a mask for you to wear in the hospital, in the store, whatever it might be. Please, I beg you to make this decision. It is so important to myself, to my husband, to my children, and to many other people in our community. Thank you so much.
Thank you very much, Elizabeth. Good evening.
Hi, Ruth.
Hi guys, Madam Mayor. I didn't come here for this. I'm here for something else that's on your agenda. But I guess I'm kind of tired of our governmental authorities sitting around and doing nothing on this issue. Ms. Irby talked about you setting an example and you leading. And if you do that, then others would, and then the children would follow. Guys, you're being led by children right now. I'm going to tell you, at the USD 480 facilities, those children all wear masks. And I've talked to a number of administrators and said, so tell me, was this a problem? They said, no, very few exceptions. Kids put them on, they wear them. What's got to happen, it seems to me, is somebody's got to have, balls isn't the right word in a public place, but that's what it takes. You got to have some gumption, guys, and say this is the right thing. Every meeting that I've seen where this has been discussed, healthcare providers have come up and begged the public body to do something. I'm sorry, I think if you don't do something for them, you're showing them a great deal of respect. And they're putting their lives on the line for you and for everybody else in this community. And not one blasted thing is being done. I go down to Oklahoma periodically to see my grandkids. And I can tell you, I don't know what kind of mask mandate they've got or if they don't have one or not. But I can tell you in Oklahoma City, every establishment I went into, their staff was wearing masks. Everybody who went in there was wearing a mask, and nobody was complaining. They're used to it. We come to liberal, I mean, if you come to liberal, I'm sorry, if some county commissioner thought that we're doing a good job of wearing masks, they're an idiot. Because we aren't. Go into any retail establishment, with a few exceptions. Most people aren't wearing masks. The staff isn't wearing masks. So why don't you guys get on board, follow the lead of the children of this community, and help out everybody who's here. It's a flippin' piece of cloth, guys. What's the big deal? I mean, seriously. It's not like they're asking you to, wear some uncomfortable belt or a hat. It's a piece of cloth. I don't understand what the opposition is. I truly don't. There may be some points out there by people that say, well, the masks really don't work that well. I'm going to tell you, read whatever you want, but the majority, almost 100% of the credible medical literature says it does. Maybe it doesn't help the person who's wearing it, although they are saying that it does a little bit. But without a doubt, it helps the other people that are in your community. So help us convince others to help the rest of the community. Because you're not helping anything now by not doing this. And I'm sorry, guys, I don't understand what the problem is with telling somebody wear a mask. It's easy. Yeah, okay, who likes to do it? It's a pain in the butt. But it doesn't hurt. It doesn't cause any problems. So I'm asking you to do what the county commission couldn't. And I don't know if you can amend your agenda and put that on the agenda tonight, but I swear to God, I wish somebody would step up and do what's right. So there you go.
Thank you very much, Rick.
Good job.
Good evening.
Good evening. I'm Pam Hicks, 421 North Sherman, apartment 4. I'm in charge of the pharmacy at Southwest Medical Center, and I just want you guys to know we are being overrun. All of this issue with the mask wearing and people being told what to do, there is a documented study that is a study from the state of Kansas that has just been published in the CDC Morbidity and Mortality Weekly Report. It's a public document from the 20th of November. They studied the counties in Kansas that had mask mandates that kept through the summer versus the counties that did not have mask mandates. And I apologize for reading, but I didn't want to get the numbers wrong. For the counties that had the mask mandate, they saw a 6% net decrease in the number of cases of COVID. For the counties that did not have a mask mandate, they had a 100% increase in the cases of COVID. This is our own state. This is our own data. So I think it needs to be considered. I listened to the county commission meeting, and there was a lot of data thrown out that was not correct. Masks work. If we just enforce 3 things or encourage 3 things, wear a mask, watch your distance, and wash your hands, it can have a huge impact on the health of our community. Because we're stressed to the point where we almost can't take care of what's coming in our doors, and something has got to be done. So if you want to look up that study, if you go to the CDC website, look for the Morbidity and Mortality Weekly Report for November 20th. It has that study and has all the data, and it is real data for our state. So, thank you.
Thank you very much, Pam.
Ma'am,
Yes.
were you the person that got the grant for us to get the COVID, told us COVID test?
Get the what? I'm sorry. The drugs?
Yeah, the drugs that are available at our
Yes.
hospital.
I am.
Thank you. I believe you saved my life.
You're welcome.
Hello, my name is Raquel Bryant. I'm the ICU nurse manager, and this is Candy.
Candy Head, I'm the ER nurse manager.
I want to thank you guys. A few of you guys came out to the hospital, and I got to speak to you, and I really want to thank you guys for taking your time to do that. It did mean a lot to us and the staff. And so we're just here again to just reiterate that the mask mandate is really needed. I know it's a hard decision. I know some people don't want to do it, but it's the right thing to do. Our hospital really is taking the best care of the patients that we can, but we are full. Jandy sees it every day in the ER. They're having to transfer a lot of our patients. Our resources are getting very limited with space, staffing, and things like that.
And I know there's a lot of confusion on does it help, does it not help. We have seen that it definitely does slow the spread. So you have a large group of people, none of them are wearing a mask, most of them are going to get it. You have a large group of people, a lot of them are wearing masks, there's definitely going to be a lot less that are going to get it. And the purpose of that is to slow the amount of patients that we're actually seeing in our facility, because right now we are seeing a big influx of patients, and we're a fairly small hospital in consideration. So we are definitely seeing some trying times, and we're struggling with how to manage all of the patients that we are seeing. We're seeing a lot of very sick, very serious, very critical patients, and it's definitely been a struggle to try and figure out how to take care of all them. The other thing that I want to add is we're also starting to see some flu positive patients, and normally the flu season is already busy in the ER and in the rest of the facility, and masks do help slow the spread of the flu as well. So in addition to helping with COVID, it'll also help with the flu. So we've never seen anything like this. I've been in the ER for about 10 years, and it's definitely been a very trying time. Our staff is exhausted, but they are doing a wonderful job continuing to take care of everybody. They're being creative. They're finding locations. They're finding hospitals all over pretty much that they can transfer our patients to, because oftentimes we don't have the space or the staff to take care of them. So that is our request, is to initiate the mask mandate so we can help slow the spread of COVID, help slow the spread of the flu, and ease the burden on the hospital a little bit.
And I want to kind of circle back to what she said about, does wearing the mask help or not? When you guys came to the hospital, Dr. Ilyasov spoke to you, and he brought up the viral load. So let's say that let's say I'm COVID positive, I'm around Jandy, I'm wearing my mask, she's wearing her mask. The chances of her getting it, they are there. But will she be as sick as someone that wasn't wearing a mask if if we're not wearing the mask? I don't know if you guys have seen, there's been several memes and things like that that kind of talk about, how things spread. So that's another, I think a lot of people say, well, my friends wore their mask all the time and they still got COVID. Were they as sick as they could have been? Did they end up in the ICU intubated? That's what we're really trying to prevent, is for those patients to get as sick as those patients that we're seeing. We have some 40-year-olds that are on vents and things like that. Those are things that we normally don't see.
I thought that was one of the most valuable pieces of information shared while we did that tour, was about the viral load, because that's not something that I've seen really any accurate information released from KDHE or the CDC or anything else in the public media about, and drastically changed my view on it, just essentially because when you take out the factor of not considering that a mask is going to keep you from getting it, but a mask is going to very much lessen the severity of getting it, which takes the load and strain off the hospital, makes a heck of a lot more sense than the arguments that you hear in the national media. So Thank you guys very much for having us up there, because that was a very enlightening and scary experience as far as seeing what you guys are going through. But it was definitely something that I wish all of us elected officials could have partaken in at a much sooner date to be able to get a handle on this before it got this bad.
Thank you.
Can I ask you a question though? I guess I don't understand what you were just, so you're saying that somebody that gets COVID can get it at a different level?
So, and actually Pam might be better at
They either
explaining
have
those
it or
things.
they don't have it, they get it at different levels?
They get different severities of it based
Yes.
on the amount of the virus that their body intakes that takes effect.
Right.
So essentially, if you and I are both wearing masks and I'm COVID positive, and you end up contracting COVID, if we were both wearing masks and your viral intake of it was very low, then you're going to have a very mild case of COVID-19, probably just experience the most mild symptoms, be able to quarantine at home. Versus if we weren't wearing masks and I had COVID and you're sitting there having a huge viral intake, you're probably going to end up getting hospitalized and being on a ventilator because of the amount of damage it's going to do to your system.
So is that why they go back to the part where they said that being in direct contact with somebody for 10 minutes or more?
Correct.
Because
Yes.
you're just increasing that viral intake.
So if you're not around anybody for more than 10 minutes, then you're not really gonna
You're at
get
a lesser
that
risk.
anyway.
Yeah.
You're at a lesser risk. That's why we also bring up that social distancing.
Yeah.
So if I'm talking to you from here to Janice, or from me to her, it makes a big difference on that exposure. And Pam, do you want to kind of talk about that a little bit?
They know now that the people that don't have any symptoms are spreading the virus probably at a higher load, that you're putting more virus out. That's why it's so important to keep your mask over your nose as well as your mouth. You are more likely to both inhale and get the virus through your nose and exhale it through your nose actually than your mouth. And you'll have more viral particles. So if somebody is shedding virus at a very high rate and you're in contact with it, you're likely to get a pretty good dose. Think of it in terms of a dose. You're getting a pretty good load, a pretty good dose of that. So your chance of getting it worse, because you're going to have more virus in you that your body's going to have to fight off, than if you get a very light load. You may still get some symptoms, but your body's going to work to try to fight that, and it's going to have a better chance of knocking down a little bit versus knocking down a whole lot. So if we all wear masks, and the type of mask is important. They found that you need at least 2 to 3 layers. These gaiters that a lot of people are wearing are virtually no good because they actually help aerosolize the particles, and they're smaller, and it makes it easier to pass it to the next person. So the type of mask, how you wear it, all of those things have played. But if you have 2 individuals, if both have a mask on, the chance of one passing to the other drops way down. So that's what, when we're talking about viral load, that's what it's about. It's how big a dose of it essentially that you get.
And did I hear you say that the non-symptomatic positive person is going to admit more virus?
They're probably shedding more because they're in the process of building it up. So.
Building it up, building immunity, or?
No, they're headed towards symptoms more than likely, but the virus is actively replicating in their body. So they don't have.
Are those the people that get it but never get sick?
Right, and they're actively spreading it, and it's like, we may know someone's positive, you may have no idea about somebody else, and they could be actually a worse spreader than the positive one that you know. It's a scary disease, and people are dying. Well, Dr. Eliasov gave an example, Ronnie, if somebody coughed on you or sneezed on you, then you would get a giant load from that, as opposed to just.
So there's us people that never get sick, we're just lucky, and it doesn't matter what they do to us, we don't get sick. There's just some of us that don't get sick. Is that it?
Well, I mean, there's going to be people that have natural-born immunities to any viral disease that we have outbreak. I mean, that's going to be a significantly small portion of the population. I don't think they've identified anybody who has natural immunities to COVID-19 as of this point yet.
The COVID-19, it affects a lot of different symptoms, so the way you react to it, if you're exposed and get it, you may react very differently than you would because of just underlying conditions, or it's just your makeup. They don't know why it hits different people in different ways. So there's still a lot to learn about it.
Yeah, and essentially, social distancing, masks, nothing's going to stop the spread of it. It can slow down the spread. But now that the virus has already been this widespread, I mean, at this point, it's just mitigating to make sure that we can try to slow the flow of what the hospitals are having to handle. Because as far as I know from making calls this morning, there's still really nowhere to airlift anybody to from here. And if it is, it's multiple states away, and that's going to put a huge financial burden on the person who's receiving that medical treatment that wouldn't have had to have that expense in the past anyway.
I have a friend. She was a nurse at our hospital. She doesn't live here anymore. She lives in San Antonio, but she let us know that her family's from Moscow area. They had to transfer her mother to Wichita, her father to Tulsa, and her brother to Kansas City. So her family's all just kind of spread apart because.
Yeah, how tragic is that to have everybody so spread apart?
Because we weren't able.
Such a difficult time.
Yes.
Thank you.
Thank you, ladies. Good evening, Keely.
Hi, my name is Keely Morey. My address is 722 East Carlton in Liberal. Speaking on behalf of many people who are here tonight from our facility. It's obviously, an issue that's very close to our heart. I understand that a mask mandate was not on this entity's list for today. However, you all have the ability as a government body to be able to implement something that our county commissioners did not. There are many other communities like this who have had one entity say yes and the other say no. And that is something that you all have the ability to be able to impact for us. I work as a vice president at the hospital and can tell you that this has not been easy for anybody. It certainly has not been easy for the community itself. Our capacity, as we mentioned to many of you on Friday who were able to attend, continues to change by the hour, sometimes by the minute. At one point last week, we had a surge in our emergency room of 18 patients at the same time. We do not have the ability to say no. We have to take patients into our facility and be able to give them the treatment that is needed for themselves. Having a mask mandate in place is not about curing the virus. It's not about preventing a person 100% from obtaining the virus. It's about slowing things down. Where we're heading right now is not sustainable. This is the effect, if you count back the calendar days, likely to people who got together around Halloween. If that's the case, coming into Thanksgiving, Christmas is not looking good for us. It is not. We have the factual information, we have data that shows that a mask mandate can support the public's ability to comply, their willingness to comply, and the ability to slow the spread, allowing us to conduct regular business. I understand that enforcement isn't going to be easy, and there are a lot of questions. Doing nothing does not change the situation for us. We're going to be further down a path that is not sustainable, as I said. We have had to implement change upon change upon change upon change. It's exhausting. We've been dealing with this for 9 months now. I understand, again, enforcement's not going to be easy. But again, think about all of the change that many others in our community have gone through to try to keep the community safe. Many of our plans perhaps didn't work as we expected the first time around, but we continue to change. We continue to look for ways to make it work because at our facility, it's our only choice. We have to find a way to make it work. A mask mandate is not about creating fear. I hear that consistently. It's about creating fear. That's not what this is about. This is about creating cooperation within our community so that we can slow the spread of this virus and be able to adequately take care of the people within our community. I encourage, if there are any more people from the hospital, to get up. We did not mean to commandeer this entire meeting, but it is something that we need you to hear, and that's important, not only for us and the work that we do, but for the lives that we're taking care of. This isn't about how many beds are filled. It's about how many lives are in our hospital, how many families are experiencing this, and where can we get them to the right level of care. And right now, we are exceeding capacity, and we're heading towards a path that is not sustainable.
Thank you, Keely.
Thank you. Anyone else like to speak?
If it's okay with you, our emergency department director, Dr. McGordy, is unable to be here. He also covers hospitals in California, and he has written a letter for me to read to you. May I do that?
Absolutely.
Okay. Thank you.
Tell us his name.
Dr. McGordy, what's his first name? Edwin McGordy.
Thank you.
Thank you.
But he actually lives
Here in Dublin.
here in Liberal, but also in California. So, okay, sorry, your phone locked me out. Sorry. So, just so you know, the first part of his letter is about the study that Pam was talking about from the MMWR mortality from the CDC, and it's all about statistics in the state of Kansas. Okay, so so then he goes in to say, I am uncertain how this went wrong. Okay, this is the masks being worn in some counties and not in others. Seen a high increase of 100% increase in cases in the counties where masks were not mandated. I do not know how wearing a simple mask could become a personal freedom issue, and do not understand why it is not a protect your friends and neighbors issue. The rate of infection in Southwest Kansas is extraordinarily high. And remember, take into effect that he practices elsewhere in the United States. It puts all the healthcare workers and physicians that work with me in the emergency department at increased risk. As the infection continues to rise, you will see a limitation in the services that are available. You will see longer wait times. You will see difficulties in being able to transfer patients to other facilities because the other facilities also do not have the staff or rooms in order to take care of the sick. This is happening now, as you have heard from Jandy, our emergency room nurse manager, and also our ICU nurse manager, Raquel Bryant. Our emergency room is full. The hospital is full. Wearing a mask has been shown to decrease infections in the state of Kansas. It is a simple thing that we will help keep people healthier. It is neither a religious or a political issue. As I look at what is occurring to the community, I remember my times on deployment when I was on the active duty for the U.S. Navy. I remember the need to wear Kevlar and body armor and take my assigned weapon everywhere I went. In 2 cities in Iraq and 17 provinces in Afghanistan, I did that. Every day, every hour for the entire deployment. Many times we could not see the enemy, but we did things to protect ourselves and our brothers that we served with. I am stunned that people are not willing to wear a mask. I thought as the country and as a community, we were stronger and had more commitment to each other. That we were willing to do the simple things to protect each other. Life is about sacrifices and doing the right thing. Our parents have preached this to us. Our faith instills this in us, and my training as a physician and military officer allowed me to put this in practice on a daily basis. I implore you to pass a mask mandate. I plead with the citizens of this community to follow the mask mandate. It will keep our healthcare workers safe, it will keep you safer, and will keep your friends and your neighbors safer. When you see me around the community, you will notice I am wearing a mask. I know not everyone at the hospital wears them outside of the hospital. I absolutely think that should change. I call on everyone to do the right thing and protect each other. And remember, that was from Dr. Edwin McGordy as our emergency department medical director.
Thank you very much.
Thank you.
Anyone else? Greg, did you want to say something?
I'm available if you have questions, but I think these people have made a
Tell the case.
They've said it, and they've told you the truth. They're factual. This is going to get worse. They've said it. I need to get on the stump, I guess.
This is the 3rd meeting I've sat in where I've heard the exact same thing said by mostly the exact same medical professionals. So yeah, it's loud and clear.
I truly wish you had all been at the meeting last night. I listened to it and I didn't hear you at the meeting last night.
Still working last night. Yeah, same. That's why we were late working.
I think the county commissioner should have heard you. Might have made a difference.
Lynn,
Anyone else want to speak?
what can we do if, I didn't need the 10-day or the tour Friday, I had a 10-day tour. So, and all you guys were part of that. What can we do? And we want to test it for 30 days? Is that what they're asking? Where we could, if it didn't work, end it, or?
Well, the city
County turned it down.
Or is the governor going to mandate it at midnight tonight?
What happened was the governor issued her mandate, and it gave the counties the opportunity to do nothing, which means they're going to have to follow the governor's mandate, to pass their own mask regulations to supersede that mandate or to opt out of that mandate. And if they did all that before the deadline, which was 12:01 on the 25th, then that's what would happen. The county opted out of it, which means on the 25th of November, 12:01, Seward County, as it stands, has no mask mandate whatsoever in effect. What the city commission can do, if it so chooses, is you can pass, it would be an ordinance form, it'd be by recommendation, where you can put the mandate into place. You can actually criminalize it, you can make it a fine, you cannot make it a fine, you can just say, we're going to make a stance and make this. You can do a resolution which just says, we're gonna mandate a mask requirement and have no penalty provision, which basically means you have no enforcement provision for that. It's really up to the commission what the commission wants to do, how far you want to penalize it, or if you want to do anything at all. As far as tonight goes, if you want to take any type of action, obviously we don't have a written document here to pass or approve. I think you could amend the agenda to add an item specifically for mask mandate / COVID, and you could potentially just pass a motion tonight that what the commission's stance is on it, and that we're going to take further action on a later date in the resolution or ordinance format. We can have a special meeting to discuss that at a later date. Obviously tonight we have a lot of health officials that are present. There's a lot of different opinions on this issue, obviously, and you all represent all of the constituents within the city of Liberal, Kansas. It may be a good idea. It may be a really long meeting to do something like that, but again, it's up to the commission here. I don't have the means to whip out a resolution.
Well, can we jot one up on the fly?
No, there are a lot of models out there. It wouldn't be.
Well, so I've read through 30 or 40 throughout the state at this point, whether they're county or city based, and there's really 5 things for this commission to consider if we choose to go the route of wanting to implement a mandatory mask mandate. So the first part of it is obviously that we'd be mandating that masks are going to be required to be worn anywhere that's considered public domain. So this is why I say that there's 5 specific things that we all need to consider going into the agreement that we even want Lynn to draft up if we choose to take that route. So enforcement on something like this is nearly impossible because once the courts open back up, pretty much every one of those fines that's been issued out is going to get thrown out of court. It's impossible to back up a law that doesn't exist.
Well, the county attorney said he would not support it.
Exactly. Yeah. So you have
nothing.
so you have a lot of places that have passed mandates without enforcement, knowing that there's really truly no way that it can be enforced. So enforcement's one thing to consider. Another thing to consider is private business restrictions. My opinion as somebody who has a private business is that businesses that have been open and operational all year, and businesses especially that were closed due to a shutdown and had to make a lot of changes to be able to reopen back up, most businesses have already implemented pretty severe changes from the beginning of the year till now. But you have to consider that what the city of Liberal has the jurisdiction of authority to do is mandate public domain. When you walk into a private business, you're no longer in public domain. When you walk into your private residence, you're no longer in a public domain. So those are the things to consider, is that I've seen some that put regulations on businesses. I think that is really a far cry reach, because what you're hoping is that businesses will obviously have either already mandated a lot of these changes, or that once the mask mandate kicks in, at a bare minimum, that they're going to require that all of their employees wear masks, things of that structure. Regulating anything in a citizen's private home is really difficult for me to see how that is not government overreach. So the couple places I've seen in Kansas that did that, I think they're going to have a field day once this is all over with handling that in court. So that's something to consider as well. And then also, one question I would have is the gathering limit that the county imposed. That's still in place. That would have been the one last week. Right. So a mandate passed by the city would not be required to have anything about public gatherings in it, because that's already covered by the county's mandate, and we don't want to start doubling up on different kinds of mandates to where we have no idea what the rules are or what's going on. My main thing would be is that I would want to know a consensus from the commission that this is even worth having Lynn take the time to write up if we choose to go this route, because I've seen so many of these meetings too recently with the county where there was 2 hours worth of fighting and deliberation and divisiveness between people in the community and medical experts and politicians, all of it to be for nothing. So if we're going to go that route, I would want to know going into this that it's not going to be a complete waste of time.
And I would say, Vice Mayor Hart, before we spend more deliberation on behalf of the commission, which we've already touched on this, we probably should, if we're going to talk about it more, have a motion to amend the agenda to add this as a discussion item just for tonight, so we can openly discuss it and have that motion made and approved, so that way that is done, we can add it as an agenda item, whatever, address it and talk about it openly, so we don't violate any type of issue.
Yeah, absolutely.
Has anybody understood what the governor wants to implement?
Well, we all understood it, but the area's already opted out of it. Just so we can continue this conversation in accordance with our legal counsel, I'll make a motion that we amend the current agenda to add agenda item, I guess we're going to say 14A, to have a COVID discussion.
I'll second.
Motion by Commissioner Hart, second by Commissioner Martinez, to add an agenda item to, have a COVID discussion. All in favor? Motion carries.
All right, so now we can speak freely.
No, we already have.
Yes, yeah, but I appreciate that much. You know, go ahead.
Well, I was just talking about what you were talking about. So you're saying private businesses, it would be hard to regulate?
Well, yeah, so
We're
I
not
think,
gonna go into people's houses.
exactly. If the government ever telling people what they can do in the private, they're in their own private residence
Your car,
is
your home.
so much of a government overreach, it's not even funny. It would get overturned in any kind of Supreme Court. Private businesses, I think in an area like this, most of the businesses I've seen already have these regulations in place, and the reason that they're so desperate to get a mask mandate passed is so they can reinforce the regulations that they already have. I haven't seen a lot of businesses that have no regulations whatsoever. Most of them have either mandatory masks need to be worn in the store. A lot of them are starting to get temperature checkers. There's only a few places I can think of in town that I've been that don't seem to have made a lot of changes, and I think that those would be kind of peer pressured onto them. You know, it's kind of like the enforcement. I highly encourage us to not take that route if we decide to do a mask mandate, because it's completely unenforceable. What my concern would be is that you're going to, if you try to enforce this, you're going to introduce the possibility of violent altercations that didn't need to happen between a police officer and a peaceful citizen, because people are awfully riled up about this. And the last thing that we want is for somebody to take a swing at an officer and end up actually having a permanent criminal record because they got 2 tenths about, you know, an altercation where they were being told to wear a mask and they didn't want to do so. You know, it very much, you know, with a mandate that has no enforcement, it very much comes down, in my mind, to an issue of morality. Of, you know, if you know that these are the rules, and you see everybody around you wearing a mask, knowing that those are the rules, and you're not wearing a mask, you should, in all, you know, general sense of the term, feel a sense of shame about that. That like, oh, I'm the one that's not abiding by the same thing that everybody else is going through. But enforcement, I just see as an impossibility. It's just going to create complications throughout. And it's kind of unnecessary because, like I said, there's no state or federal level statutes. And correct me if I'm wrong on this, Chief, but I mean, there's no state or federal level statutes that cover anything inside of this category of things. So, yeah, so if we're writing it, you're literally writing somebody a citation for a law that doesn't exist.
You can make a law that exists as an ordinance.
You can make
I
a
don't know
law.
if you want to go there.
Well, because
And it's enforceable.
well,
but
my
it's-
understanding if we do that though is if people will take that to court more than likely, and if they do, once it hops to the state level, we're not going to have any kind of legal backing at the state level for the local law.
I guess I don't understand what you're saying. I mean, you can pass a city ordinance that says, I don't know, traffic infraction is a fine or it's jailable. I mean, you can make it as severe as you want within reason. And then they can get convicted and appeal across the street to district court, which would be heard from Judge Peterson. But so long as the city passes the ordinance and based on home rule authority and it has justification for the same, I feel it would be affirmed. I think so.
Okay.
I'm not saying it's something that you should.
That we should do, but it is possible.
It would be up to the commission, obviously, to make that decision.
And then you'd be hoping you're doing something, going to that level, hoping it's something that actually really works, because we still have done people with masks already sick, right? But, so what we're saying is, the people, if we did one, the people that aren't gonna wear one still aren't gonna wear one, but we're not doing anything to them, and the people that are gonna wear one, because being responsible where they need to be responsible, are gonna wear one. So we're right back to what we should do is ask the public to wear a mask.
I think the biggest difference if you have a mask mandate in place is, for example, so if somebody's trying to walk into buildings and they're not wearing a mask, and the private business has mandated that you are required to wear a mask. Right now, just like somebody in the audience had described about there being a situation where somebody says, well, I'm not going to wear one, I'm going to sue you because you can't make me. Well, if the city that business is operating inside of has a mandatory mask mandate for that, then they have the backing to say, you can either put a mask on or you can go shop somewhere else, and there's no way that somebody can say, hey, we're going to sue you.
Well, that was going to be my question for Lynn then, is because do we not have the right, for these businesses, if they have their rules in place, they have the right to refuse business to anyone for any reason, right?
They do.
And can we not say that we will support those businesses with the police department if they have somebody that's belligerent, that they have our support to remove those people from their business.
Yeah, they have that right anyway.
Yeah, because trespass.
So in reality, we have enforcement to help those people that want to enforce a mask mandate in their business.
Already, it's already in place, yes.
Yeah, technically.
And we just need to make them aware of that. And that's what I'm saying is, can we not, everybody's talking about trying something for 30 days, can we not ask the public? I don't particularly like to wear a mask, but guess what? Every time I go to Walmart or Dillon's, or I'm going to be around people now, I wear a mask. Just because of what they said, to be considerate for the other people, because I don't know that I believe that it's going to keep me from getting sick, but if I'm carrying it around like she's telling me that I may never have any symptoms, but I could give it to somebody else, I don't want to give it to somebody else. So why do we not just ask the public to be responsible and wear a mask, and tell the businesses that we will support them if they have problems enforcing that, if they choose to enforce it. And the businesses that choose to not enforce it, the people that don't want to go in there don't go in there. I mean, that's what freedom's about. I mean, you don't have to go to a business that doesn't require you to wear a mask either. Like, you know, it's the same both ways.
Yeah, no, I've had to explain that to plenty of people that, you know, a TFA up to this point, now we're implementing a mask, required mask mandated TFA and textile tomorrow, pursuant to the governor's orders. But up till now, I've had to tell people that the reason you don't see me with a mask in there is because we have very low volume of people in the store. It's spaced out. But you'll always see me wearing a mask in another store, because the same right that I have to dictate what you do in my store is the same right that I'm going to respect when I go into another store.
So my thought is we should probably, before we have Lynn write something up, is schedule a special meeting. That is the agenda topic, so that we can have presentation for both pros and cons, because you guys represent all the citizens of Liberal, and I think you should, in all honesty, hear from both sides. That's just one man's opinion.
Yeah, that's...
In the past, throughout this whole situation, we have followed the recommendations of the county commissioners, because they control the health department, they control the emergency operations center, they control the people who call people about their illness and follow up with people. They control all of this, and we have followed whatever they have recommended. So we have no control over the health department or health issues, really. So we told the county commission we would follow whatever they decided on the mask mandate. What about somebody that lives in Kismet and they come to Liberal?
People from Kismet that come to Liberal wear masks now, to my knowledge. I don't know of any exceptions.
Except for the ones that don't.
Yeah.
I don't know of any exceptions.
Well, Commissioner Malin assured that there were only 2 people in Walmart who didn't have a mask on, and only 1 person in Dillon's that didn't have a mask on. So there's some very unusual. There's some very unusual reasoning about this.
Well, I could say from my experience from going to Walmart 2 weeks ago, there was a lot of people in there with no masks on. And ever since it's been a hot topic in town, when I went this last week, there was more people with masks on just because of the talk. So I think that people are aware that they should be wearing masks. It's more peer pressure. And I think this should be, I'm not opposed to people leading a campaign asking people to wear masks, to be responsible, and your sign that you guys put up. I think that at some point, because you're wanting to see your numbers change. Have the numbers changed for you in a week since they started talking about it?
The numbers continue to increase, and I think that's something to think about as you think about what you may or may not choose to do, actions to take or not. We're experiencing, most likely, and I think Pam or one of them talked about that this is probably generally the effects of October, Halloween parties, etc., and so on. You know, we had an incubation period of probably, on the average, 6 to 7 days. Then you have, so we have a spike in cases. You know, if we created 150 cases on Halloween, they all gave it to 3 or 4 more. It takes a while to get sick enough to show up at the hospital, and I think that's generally around 20 days, but give or take, you know, because people get sick, some of them get better in 2 weeks, and the ones that don't get better in 2 weeks oftentimes wind up in the hospital. So if you're going to do something, 30 days would be barely enough time to see a difference. In 45 days, you would probably more than likely be able to see some reduction from that use.
So in reality, if more people have already started wearing masks, we won't see that difference
for
a couple of weeks still.
Yeah, 2 to 3 weeks before you're going to see a change. And God, I hope that's true. I hope there are more people out there doing it. I don't know. You know, I avoid stores because I don't want to go. I think that's also a thought process for all of us. You know, if what we've been doing was working, would we be talking about it tonight? So, I'm not sure it's been working.
What kind of PR program is the county going to do?
I don't think they've made a decision on that. And Lord help me, I think they're meeting next Monday. I don't know if that's a topic that will be discussed or not, but I know that there's an intent to pursue that and try to do more PR. Most of us are, you know, pretty busy, I guess I'll say that. There's 4 of us that work routinely 12 to 14-hour days, and sometimes they're longer. And we're probably the 4 that would likely be the ones to do some of that work. We do a little bit of it, but it's just really not something that we have the time for. And I would comment also, and I think it's important that everyone understand this, the OC is run under the auspices in this present disaster of a unified command. So command decisions are made by the Representative Kelly Kirk of the City of Liberal, an outstanding leader, by the way. Greg Freelove from Southwest Medical Center, who has done a fabulous job for us. And one member, Gene Ward, the sheriff-elect from the county. So the city has as much say in what is done in the EOC as the county does or the hospital does. We put it together that way on purpose because this wasn't a county disaster, it wasn't a city disaster. It's weighing awfully heavy on the hospital right now, but it isn't truly isolated to them, and they can't control it by themselves. They need the city and the county to work together to mitigate what's going on in our community. So that's what they're asking for, and I think it makes good logical sense that if we've tried something for 7 months and it hasn't worked, I'm not so sure going back to the well one more time is going to change the outcome. So
I think we need to go. We need to have a special meeting to further discuss it, hear from more people.
Did you want to speak?
Yeah, I would just like to go back to your comment about like 1 or 2 people not wearing masks in public. Just because they have it like on their chin doesn't mean that it's gonna help us. If they have it under their nose, it's not gonna help us. Just because I go to Dylan's and I have my mask hanging on, that doesn't mean that I'm helping out the community. And that is what I see in public. People wearing their masks under their nose, under their chin, that's not helping anyone.
Agreed. What's your name?
Daisy Torres.
Daisy.
I do have one more number that I failed to put out. As the person over, or the screeners at Southwest Medical Center, I supply masks to the screeners to have available to people that do not have them when they arrive at our facility. We would prefer that people bring their own because it is a cost to the hospital to purchase these items. And on Monday morning, yesterday, 8 a.m., I supplied 50 masks to the screeners. Within 24 hours, I was notified by them because they'd been told to tell me when they're running low. Within 24 hours, they had already given out 41 of those masks. And we are watching that closely because to purchase those and to get stock here in a timely manner is something that our materials management department watches very closely, especially right now with this pandemic, because they are not easily purchased and delivered in a timely manner. So that was a significant increase that what I have seen in the last 2 weeks. So thank you.
Well, Connie, I'd make a motion that we table this discussion and set up a special meeting to invite the public for just that item. I'll second.
Motion by Commissioner Warren, second by Commissioner Martinez to table this item and set up a special meeting for just this one item, the mask mandate, and to have a discussion with the public.
We need to set that time with this motion.
I think we just vote on that and then we'll have a discussion.
Okay. Then we'll set it and let the public know. Okay.
Any further discussion? All in favor? Motion carries. The item will be tabled for tonight.
Now that we're all here, we want to try to get a date what time it works with everybody's calendar so we can inform the public through this meeting, and also they can touch notice if it's required.
Let's say Thursday at 12 o'clock.
Is there any way that we can squeeze this in tomorrow before the holiday?
No, you couldn't get proper notice.
Proper
out.
public notice.
Yeah, and I would recommend changing the venue to probably say the Girl Scout building
or Rehearn Park.
Or no, either that or South Middle School, the gymnasium.
Yeah.
Because we need to be able to, regardless of the issue, we need to be able to social distance.
Yeah.
And
What about Monday afternoon, evening?
What do you think?
So I look on everybody's calendar.
Can't schedule it tomorrow, since the public is, or since the media is here, that's public notice. In case you guys do want it tomorrow, we do have.
I didn't say I wouldn't mind trying to squeeze it in tomorrow so that it's not still weighing on everybody.
You'll have a lot of people that are already taking off tomorrow to travel.
Vacation, yeah. I mean, out of town to spreading COVID.
The 30th looks like the best.
Okay, 30th.
What do you want to do it at? Should we do it after 5:30, that 5 o'clock to 5:30, so that way everybody can try to be here that works their normal 8 to 5?
Monday?
5:30.
I have the county meeting too.
Oh, they do have a county meeting on Monday.
Okay, that's the 30th.
Well, we don't have a meeting on Tuesday, so we can just.
Actually, yeah, I wouldn't see why the county's meeting would conflict with ours because they're representing different groups of constituents. So their county peeps can go to their meeting and we will have all the city peeps to ours. I have to be at the meeting to do something with the hospital.
Yeah.
He has to be at the meeting to present something to the hospital.
Meeting at 5:30.
Well, do we want to do
Make it earlier.
Tuesday?
Tuesday?
Tuesday the 1st of December, 1st of December?
5:30.
Okay, first looks like a good day for something on the calendar.
And are we planning, did we want to do this at South Middle School?
I think so.
I mean, Girl Scout building, I mean,
That's more central.
it's more centrally located and there is better parking at the Girl Scout building.
Girl Scout building? Okay.
But I mean, it's your meeting, you tell us.
Yeah, I think
like Girl
Tuesday,
Scout,
December 1st, 5:30 at South, or at Girl Scout? Okay.
5:30.
Where at? Girl Scout?
Girl Scout, 5:30. December 1st.
Still on this topic, I think we tabled it, but we'll just pretend like we did for a second. Is there kind of a consensus? Does the commission want me to at least have a resolution kind of prepared? I can have my laptop, have it there, potentially have a way to printed.
Can't answer that, we already tabled it.
Yeah.
Way to get out of that one, Mr. Ward.
I think we probably need to hear everything that's said, and then we can have a special meeting to pass one the next day if we have a consensus that that's what we're gonna do after the meeting.
That's probably a good call. All right, I just wanted to verify.
I wouldn't want you to do a lot of work without knowing how
we
to.
talked about that before, I didn't want him to waste his time.
Okay, are we ready to move on?
Yep.
Yes, ma'am.
Okay, the next item is the city manager's report.
Actually, I don't really have a whole lot to say, other than I want to thank the staff for a great job and wish a happy Thanksgiving
Thank you
and
all
safe
for
travels
coming.
for those that go. Also, our Foss Ford, our first annual Foss Ford Turkey Bowl, it was our second annual Turkey Bowl. We had 8 teams in 2 different divisions. And actually, from what I understand, they booked 80 motel rooms. And using Redskin Field, I want to thank 480 for the use of the field. Of course, we only had 2 teams there at a time. And of course, with 2 sides, we were able to social distance, and Nick was steady on him to mask up and social distance. It really turned out to be a good event. I want to thank Larry Kahn on Foss Ford because he showed up, presented the championship trophies to the winning teams, and didn't bring any new cars to give away, but you know, it's really good, and he has agreed to sponsor the first girls basketball tournament. So we're getting on the right track with sports tourism. Concession stands were a huge success. I think they said in over 1,000 in sales. So just want to thank everybody that was involved in that, and thank Nick because hey, once that starts, he was there from 7 o'clock in the morning till Saturday night, probably 1 o'clock. Yeah. So, just want to thank everybody and let everybody know sports tourism is starting to work, even through the COVID. The COVID cost us 6 teams this year. We really should have had 14. We lost 6 due to quarantines or this and that.
Anything, Lynn? Well, I just want to thank all the city staff that put up the Christmas decorations. I know that's a big job, and I'm sure you're glad that you've gotten it up and before the weather turns bad, and it looks very nice. And I also want to thank Nick and Bertolo and all his helpers who put on this tournament. The city was busy this weekend. You could tell we had out-of-town visitors, and it was a good economic development for the city of Liberal. That's all I have.
Everyone, thank you so much for coming and taking up your time this evening to be able to share with us. Greatly appreciate that. My favorite meetings are the ones where we have a ton of items from citizens, so thank you guys very much for that. City staff, try to stay healthy. I know we've been kind of wavering on numbers in different departments from different time to time, so hope that everybody that has gone through COVID is on the mend and feeling better. And will be quickly back with us because we definitely miss you guys. So everyone in the public, thank you very much.
Yeah, I don't have much either. Yeah, thank staff for doing what they do. We hope they stay safe. As far as the public, I mean, I don't mind saying that I think it's a good suggestion for people to wear masks when they're around other people. I don't have a problem with it. The people that don't want to, don't go where you're required to wear a mask, or vice versa. If you wear a mask, don't go where they don't require you to wear one. I think that's you got that choice right now anyway. So just everybody keep safe. That's all I got.
I want to thank the hospital staff that came out and testified or did a heart from the heart testimony, and on the city staff, the lights look good. I don't know who come up with putting the different colors in the stars, but that looks good.
I believe that was Brad Beard.
Brad, he's there on things.
He gave up on us.
Yeah. And
okay, I did it then.
You did. And St. Chewy's cement crews, they're doing a heck of a job, still going with the cold weather and hot weather back and forth. So. Guess that's all I got. Thank you.
Okay.
Okay, the next item is approve the vouchers.
Make a motion that we approve the vouchers in the amount of $657,004.83. Second. For Lindbrook.
Motion by Commissioner Harden, second by Commissioner Lindenberger, that we approve the vouchers in the amount of $650,004.83. Any discussion? All in favor? Motion carried.
You have a young lady who wants to make a comment.
Perception.
Sure.
I'm gonna be really quick on my best. So, the meeting that I went to a couple of weeks ago, that was the most contentious meeting that I have ever been in the city of Liberal. That's awesome. That was not so awesome to experience as a new citizen here. And so with the meeting that you're having on the 30th at 5:30 at the Girl Scout meeting, I would just like to make a recommendation that we have some parameters to keep all out war from breaking out, or even do a survey. At this point, it's either we shut down or we put a mask on. I think if we give people too many options, we're going to be going around this merry-go-round a minute. So I would recommend if we could some kind of way put out a survey to the citizens of what they want to see, and then to submit their questions. Do we have a mask mandate hotline? Do we have a hotline people can call? I don't know how fast we can put that into play.
What's your number again?
I don't know how fast you can put that into play, but I just, with the tension that's already, the temperature is already hot. And so we can, I think, put some kind of parameters on that. I think it'll be a smoother meeting where people can anonymously submit their questions, their concerns, and then you can address those that have the most weight, so that you can have some concrete, some production at this meeting and people's temperatures not flaring, because that was not a pretty sight. And to have officers in the building to come over a mask.
Well, unfortunately, our meetings have to be open to the public.
Well, I know, I'm not saying it's not open to the public. What I'm saying is submitting questions or doing a survey or.
Earl, didn't
Thank
you do
you.
some online
You're
questions one time? Were you,
Yeah, and what I found out is people cheat, and I had to change it because people were multiple voting. And I had to take it down and find one that only lets one IP, so your computer is an IP. It has a number that is identifiable to that computer. And once the computer voted, it wasn't allowed to vote again. I had to switch that. And it was 50-50 on this issue. Half the people thought we should mandate, half the people.
oh, you have done it already then, huh?
Yeah, and you're in a community that's down the middle. If you, I don't want to make any comments on the